Perfect. So hopefully everyone can see this. So hi, I'm Alex. And now it won't let me. There we go. So just I thought I'd start with a little bit about me, just so you've got a bit of context and things like that. So I'm Alex, and I'm just finished my fourth year of medical school. So I'm at Hull York Medical School, and I'm a Yorkie, so I'm predominantly based in York. And I'm in my clinical years. So I sort of rotate around hospitals. I'm not really ever on the university campus anymore. That was something I did in sort of first and second year. But now I'm sort of on full-time clinical placement. So I'm predominantly based in York, and I do a bit of in Scarborough as well, but I've also spent some time over here in Hull, and I did a couple of months down in Grimsby as well. And just so you can kind of see the process of how I got here, I did A levels to get into medical school. So I did biology, chemistry, history, and an EPQ. And hopefully by the end of it, I'm hoping to be an anaesthetic and intensive care doctor. So I thought, as we kind of wanted to make this group a bit about everyone and not just people who are right at the start of that application journey, but also hopefully this can benefit some people that are already in medical school and sort of looking towards the clinical years. I thought I'd kind of just take you through a journey so you can see where you're starting and where you're sort of aiming to get to. So kind of the journey from being at school or at university and then becoming a doctor is starting with medical school. So generally speaking, medical school lasts about 5 or 6 years. You can do it in 4 years if you're doing it, if you've already got a different degree and you're just doing it as a postgrad. So generally that's going to look like around 2 to 3 years that are preclinical. So your preclinical things, as Sunena described really, really well, is all sort of your academics, being in a classroom, that kind of thing. You may then opt to sort of intercalate at that point, which I'll go into in a little bit more detail. And then you're going to be looking at doing 2 to 3 years of clinical training. So that's where you're kind of a lot more on the wards and you're learning medicine in the clinical setting. So all of that time you're a student, you're funding it through like a student loan or something like that. And at the end of it, you graduate with your medical degree. And this is where you get to your foundation training. So this is like the earliest stages of what you might have heard being described as a junior doctor or a resident doctor. And you stay with that title all the way until you get towards the end of your specialty training when you become a consultant. So your sort of foundation training generally lasts around 2 years, and you do a new job every 4 months. And you'll be rotating around different medical, surgical, and sort of specialist specialties, which I'll go through a little bit more detail in a moment. And that's kind of really getting your foundations as a doctor. So you're learning your really basic skills. You'll be doing sort of day-to-day jobs on the ward. So things like taking bloods, putting cannulas in, that kind of thing. And depending on the jobs that you have, you do also get some responsibility as well. So if you get a job in GP, you get to see your own patients, but you're under a bit more supervision than sort of the doctors towards the end of their training. At the end of that training, you can then choose to go into your specialty training, and that's where you get to start becoming the type of doctor that you want to be. Generally speaking, the minimum amount of time that takes is around 3 years. So if you apply to be a GP, you can do that in 3 years, but it can last anywhere up to sort of 10 to 15 years, depending on what you choose to do. And generally you'll do it in sort of 2 parts. So you tend to do what we call core training, and then you go into specialty training afterwards. So core training is a bit more broad. So for example, if you wanted to be an A&E doctor, you have to do something called acute care common STEM training first, which is where you do a bit of A&E, a bit of anaesthetics, a bit of intensive care. And then once you've completed that, you sit an exam, and then you can go and do your specialist sort of A&E training. Same as if you want to be a surgeon, generally speaking, you have to do 2 or 3 years of core surgical training where you do a bit of every type of surgery, and then you can actually train to be the type of surgeon that you want to be at the end of it. Lots of people also do lots of different things that sort of breaks that time up a bit more. So a lot of people will go off and do research as part of their sort of specialty training, or they might take years out to do things like an F3 year, which is where you're not in a training program, you just sort of work shifts here and there, but you can do lots of traveling and things in between that. So in terms of like what medical school actually looks like, it's a little bit different depending on which university you go to, but this is kind of a broad layout of what it looks like. So generally speaking, you'll have your preclinical years, which are sort of 1 to 2 years. When you do those years, you're mostly in a classroom, and it's really focusing on sort of the academic side of things and your basic principles. So you're learning all about anatomy, you're learning all about pharmacology. So pharmacology is how drugs work and how they treat different diseases. You'll then start to think about sort of the biological processes that lead to disease, so that when you get into your clinical years, you can understand why those diseases occur. And in that sort of time, you might start to also build on basic communication skills and basic clinical skills and lots of things like reasoning and essay writing and things like that. You then move on to your clinical year. So that's what I've just finished. And that's where you're predominantly based on the wards. So you're seeing and interacting with patients every single day. When you're in your preclinical years, you tend to be taught a lot more by sort of university lecturers and things like that. Whereas once you get to the clinical years, you are just taught by doctors on the wards. So it's kind of a bit like an apprenticeship. And you're kind of focusing on, you get to see patients yourself and you take the history, and then you have to start thinking about, okay, what diagnosis does this patient have? Why do I think it's this diagnosis and not something else? You start to learn, if this person presents with chest pain, what investigations would I order and things like that. And that's kind of the focus of your learning. And you also get to develop lots of clinical skills. So things like taking bloods, putting in cannulas, suturing wounds or suturing during surgery and that kind of thing. You have like a portfolio of skills that you have to sort of build up. And then you go into your final year, which is what I'm about to start in just over a month. And that's where you're kind of just shadowing an F1 doctor for a year and kind of learning how to do their job. It's very much like an apprenticeship. There's not really any new content. It's more about learning how to do the job and that kind of thing. And then in between all of this, you also have the opportunity to intercalate. So we've kind of talked about this before, but this is where, so it's compulsory at some universities, and other universities it's kind of a choice whether you want to do it or not do it. And it's the opportunity to go and do another undergraduate degree or a master's degree that you just do for 1 year. And you can do it for lots of different reasons. So a few of my friends have done it in anatomy because they want to be surgeons, and it's really helpful for sort of improving your knowledge in that area. But you can also do it in something that's an area of interest to you that you'd otherwise never get the chance to study, or if you think you want to go into that area in the future. So I know people who are doing it in things like public health or women's health and things like that. So then I just thought I'd sort of explain a bit more about what happens in the clinical years. This might be useful for people who are already at medical school and wondering what the next few years are going to look like for them. It's a bit further off for the rest of you that haven't even applied to medicine yet, but I still think it's quite nice to sort of know what to expect in the future. So in your clinical years, the focus is really shifting towards learning medicine and learning clinical medicine and understanding why patients present with certain things and why it's this disease and not that disease. So you're sort of, the vast majority of your learning is done through attending clinics, going to theatres, being on the wards with doctors, and they kind of get you to see the patients, and they'll sort of sit back in the corner and watch you and then give you feedback and that kind of thing. But it's a really good way of learning because you get a lot of sort of one-to-one teaching and things like that. I think a lot of people think it's really scary because you're just being watched a lot of the time. But I think once you get into it, you really actually appreciate kind of the feedback and the one-to-one sort of learning environment. So in terms of how you're kind of assessed, it's a lot less about writing and essays and tests and things like that. It's a lot more of sort of producing a portfolio of work and feedback from tutors and things like that. And as I said, I would explain before, you rotate through lots of different medical, surgical, and specialist placements. So you'll probably see these words come up quite a lot when you're applying to medical school, and no one really explains what they are. So I thought I'd do that now. So medical specialties are any of the areas of medicine where the treatment is kind of predominantly using like medicines or different interventions that aren't surgery. So it's things like cardiology, which is heart medicine, respiratory, which is lung medicine, neurology, which is to do with your nerves, and then care of the elderly is kind of specific problems that present in older people. And then you've got your surgical specialties, which is where the treatments are kind of mostly focused around surgery. So it's things like ear, nose, and throat surgery, orthopedics, which is bone surgery, and obs and gynae, which is like delivering babies and things like that. And then you kind of get these specialist areas that don't really cross into anything else. So things like emergency medicine, which is A&E, psychiatry, which is like mental health, and then GP is kind of its own thing as well. So I thought I'd kind of take you through what a week in my life looks like as a fourth year. This was my week a few weeks ago, and I thought it was quite relevant to GOSH as it was kind of focused on pediatrics. The way we do clinical rotations at my medical school is that you do 8 weeks and you kind of do a mixture of specialties that all relate to each other, but that's very different dependent on different universities. But I think our way works really well because you get quite a lot of time to sort of consolidate that knowledge. So this sort of week I was split between York and Scarborough. So on Monday, I was in the ear, nose, and throat surgery all day. So in the morning, I watched a tonsillectomy, which is removal of the tonsils, which are like these small glands in your neck. I also saw a neck lipoma removal, which is like it's like a fat bubble that gets stuck in your neck, and then also an esophageal dilation. I was sort of more on the anesthetic side, as that's kind of what I want to go into. And what's really good about the clinical years is you get to do a lot of the things that you want to do, and you don't have to do some of the other things. Whereas in sort of your preclinical years, everyone has to do the same thing. So I put in cannulas, which is where you have an IV drip, and that's how you give them the medicine. And then something else I was doing was putting in the airways. So if you can see this picture here, when you have like an anesthetic medication, you lose control of your breathing. So the anaesthetist looks after that instead. So you put this tube into their lungs like that, and then you basically squeeze this bag, which is like a lung on the outside of your body. And that's how it controls your breathing. So that's what I was doing in the morning. And then in the afternoon, I actually scrubbed in and was one of the surgeons on an operation. This was a really long operation. It took 5 of us 6.5 hours to do. But we did something called a thyroidectomy. So that's removal of the thyroid gland in your neck, which is kind of a gland that controls sort of your metabolism and how you use energy. And this particular patient had a thyroid cancer. So we took the thyroid out, and then the cancer had spread to kind of some of the muscles and glands in the neck. So we sort of stripped that open and took out all the bits of sort of cells and things from around there. But it was a really cool sort of operation to be involved in. And I think it's one of the privileges of kind of the clinical years is you get to get really involved. So then on the Tuesday, I was back in Scarborough and I was on the pediatric ward. So we did something called the ward round, which is something you'll do so much on sort of your clinical years. And this is basically where the doctors go round the ward and they see all the patients that are currently on the ward. And they kind of see how the patient's getting on, decide if things need to be changed in their treatment or if any tests need to be ordered. And then sort of the junior doctors will then go and order those tests or take the bloods and things like that. So we saw lots of different cases. We also went to the special baby unit, which is where babies that are a bit poorly when they're born go. So we saw a tiny little baby that was born at 29 weeks. We also saw a case of neonatal jaundice, which is quite common, and it's basically where your liver just doesn't quite work when you're born. So it can't process your red blood cells in the way that it normally would do. But the babies have to go under these special UV lamps, which hopefully you can see in the corner, and they wear these really cute sunglasses. So I thought I would include a picture of that because it's quite cute. And then in the afternoon, I had some skills to sign off, so I ended up in orthopedic theatre getting some more of my skills done. On the Wednesday, I was then back in pediatrics again, and I was on the maternity ward, and I got to do some of the baby checks. So when a baby's born, they have to have a sort of physical examination to check that everything's okay, and I actually got to do those on the babies, which was really cute. And then in the afternoon, I was with one of the pediatric doctors and we were on call. So we kind of have to go to more of the emergency situations. And so that included, we got called up to go and see an emergency cesarean section. And we just sort of helped the baby with breathing and things when it was born. And then we also went to A&E for a 3-year-old who had come in with something that we thought might be meningitis. On the Thursday, I got to be in GP placement. So I saw sort of lots of babies and children with things like ear infections and skin rashes, tummy pain, lots of different things. And then I was back in York on the Friday doing a ward round. So I went and saw the ENT patients, and that included the patient that I'd seen for surgery on Monday. So it's really nice when you get to sort of see that patient journey through the hospital, and it's really good for when you sort of use it for portfolios and things like that. It's great to sort of catch up with the patient and really sort of see that journey through their care. And then we always get Friday afternoons off for self-directed work, so I just finished up some portfolio work on that day. So I just thought I'd run through some sort of general top tips when applying to medical school. So one of my biggest tips is speak to the students at that medical school, whether that's going to open days or if they hold sort of events online and things like that, and just find out what life is like at that medical school. I think you can get so much from just the vibe of the students. I know I found that when I applied. The ones that I sort of ended up applying to was because I just really felt like I got on with the students that were already there. I think Sunona discussed this really, really well and probably explained it much better than I ever will do. But I think when you're applying to medical school, the teaching style and how teaching is delivered is less important than perhaps is sort of emphasized to you and how you think. I think what's much more important is understanding how you learn. I know I definitely got sucked into, oh, don't apply to this medical school because they use lectures and the science is that doing group work is better for your learning. But that's only true if that's how you learn. And I think that's a much more important thing to understand. So don't rule out a medical school just purely on the basis that you don't like the way it teaches or things like that, if you don't actually know if that way of teaching is good for you or not. Something I will particularly say is once you get to the sort of clinical years, you're kind of responsible for your own learning anyway. So the teaching style really doesn't make a difference. So definitely make sure you factor other things in when you're thinking about applying. Think about what lifestyle that university offers you. Think about sort of whether students at that university generally have a good sort of work-life balance and things like that. And then sort of my third and final tip is recording everything you do. It doesn't matter where you record it. I know when I applied to medical school, I had like a notebook where I just write stuff down. Now I have like sort of a Google Documents type thing. But just anything you do that you think might be useful when applying, just make sure you make a note of it and try and be specific. So write down the date and the time when it happened, sort of what happened. And a couple of bullet points to reflect what you've learned from that process and things like that. And just bear in mind that unless the university specifies specifically what work experience you need to have, anything can contribute towards it as long as you can reflect on what that's taught you about being a doctor or how that's going to make you a better doctor and things like that. So you can add things like if you've been to YPAG meetings and you found a speaker's talk really interesting, if you can reflect on why it was interesting and why that sort of sparked your interest, that's really useful. And also for people that are already at medical school, when you go to apply to sort of your specialties down the line, it's actually you end up needing to have a portfolio of things you've done. So don't think that just because you've got into medical school, you don't need to record any of it anymore. It's so much more helpful if you've already written it down than if you get to the applying bit and you realize, oh no, I don't know what to add to this. I can't remember what I've done. So just keep recording it, even if you don't think it's relevant right now. If you've got it written down, it's there. So yeah, just sort of be specific with it, and also don't be afraid to ask for recognition. So it's really useful if you can have sort of a quick signed certificate or a quick email to acknowledge that you were there in that place on that date on that place. Doctors are really used to doing it. They have to sign things off for medical students and their trainees all the time, and they probably had to do the same thing as you. So generally they're really understanding, but it's good if you can get that sort of validation.